welcome to today's COVID-19 update. We, of course, are speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for speaking with us again.
Well, thank you once again for having me on this program.
Yes, sir. One of the things that I wanted to begin with is the exciting news. So the Chinese Sinopharm vaccine arrived last night. Let's begin there. As Minister of Health, what is your general thought?
Well, we are happy to receive the Sinopharm vaccines. As you know, this is one of the effective vaccines that are on the market, and we're pleased to have this donation from the people in the government of China. The vaccine itself, it has an efficacy of 79.4%, which is really good. And like with the other vaccines that we have received, these vaccines would prevent you from getting extremely ill, and in most cases they prevent you from being hospitalized or end up in the ICU. So technically speaking, these vaccines prevent people who, if they get COVID, would prevent them from getting into the hospital and preventing them from dying from COVID. So I think that's really good news.
All right. So with this 20,000, I know it's 10 doses. And we've heard that you've actually said that after the protocol in place, that you were looking at teachers specifically. Could you tell us a little bit about that?
So what we want to do, with the 20,000 doses, we can immunize 10,000 people. We have started with our frontline health workers. We want to complete the frontline health workers. And then we go on to the next category, which is older people. Who would be more at risk. We first of all want to look at persons 60 years and above, but as we start getting more vaccines, we will lower that number to about 50. In addition to that, we want to also bring on board persons with comorbidities, and we know by and large that older people would have comorbidities, some of them. So we know that we might be duplicating the category, but nevertheless, if there are persons that fall outside of that age requirement, but they have comorbidities, that we'll be able to give them the vaccine. Then also, as another group of persons working on the front line would, of course, be teachers, because they would interface with students and so forth, while we haven't opened all the schools or all the classes. There is still some classroom interaction. So we want to start working with the Ministry of Education to start immunizing teachers as well. And then there are other categories of frontline workers that we'll look at as well. So the definition of frontline workers is not only frontline healthcare workers, but there are other professionals that we'll have to look at to ensure that those essential services that they're providing, that they're able to provide it without the risk of getting COVID.
All right. As we're still on vaccines, I wanted to ask you, the AstraZeneca that we're to get from India as well, that is a large shipment to come. I wanted to talk about the efficacy of those vaccines, and especially you had indicated to us that now the time frame in which you take the dose is a little wider, so that would obviously be good news.
Yes, so with the AstraZeneca vaccine, when they did the clinical trials, they found a couple of different things. So generally, it's at 62% efficacy, but if you increase the time interval from 4 weeks after the first dose to, say, 12 weeks after the first dose. So you get dose 1, and then you wait 12 weeks and you do the booster dose. Then you see the efficacy of the vaccine would go higher. So it moves from 62% to 82%. And therefore, that is the protocol that we are going to use in Guyana, to wait a little bit longer and give the second dose, and those persons who would be immunized that way, the vaccine would have a higher efficacy. So that's what we're using.
Okay.
The AstraZeneca vaccine, of course, has been approved by the World Health Organization. It has been approved in a number of other countries, and it is something that the COVAX facility has been using. So we are expecting doses from both the government of India as a donation, and we are also expecting doses through the COVAX mechanism. So from the government of India, we are expecting the 80,000 doses, and from the COVAX mechanism, we are expecting that they'll be donating to us 100,800 doses through that mechanism. We await final confirmation when those doses from COVAX would arrive. And while initially we had received indication that on the 8th of March we'll be getting the doses from India, there are some slight delays in terms of the logistics of getting it to Guyana, and we are now currently working that out. So it might arrive before, or it might arrive slightly after.
Okay, I know that especially with the vaccines from India, it came as a surprise to us because we had no idea that was happening, but that is what is happening behind the scenes. You're trying to access as many avenues as we can.
We have a number of arrangements that we're working on, and as they mature and we have formed up those arrangements, we'll let the public know.
All right. I wanted to touch on another topic in terms of the dashboard, rather. We've seen increases in both infection, but we've seen our recovery rate go up as well. And of course, this doesn't magically happen. I know there have been increases in testing centers and then the capacity of the National Public Health Reference Lab. If I got that correctly. Yes, I know that more testing can be done and so on. Could we talk about that a little bit?
So we have been working to increase our testing capacity, and we have done that in several ways. So one is that at the National Public Health Reference Lab, we have been increasing our capacity by buying more equipment, training more people to handle the equipment, and automating the process. So by doing that, something that would probably have taken 8 hours to do, which is what happened when we came in, there was a manual system that took 8 hours to process 96 samples, and that was too long. So we have automated the process, reducing the processing time to maybe an hour or 2 hours to do all of this, so we can process these tests faster. Okay. And we have not just one system that is automated, we have several systems that are automated. Okay. So in theory, we can even do more than 2,000 samples in a 24-hour period. So that's one. We have built that capacity at the National Public Health Reference Lab to do PCR testing. We have also taken PCR testing outside of Georgetown. So we have a piece of equipment at Lethem Hospital where if you have the signs and symptoms or you want to be tested, we can test you there, and within 60 minutes or so, you'll get back the results, and we'll be able to determine whether you're positive or not. Okay. We can do a similar thing in Mabaruma because we have sent such a piece of equipment in Mabaruma. We can do that in Region 6, in Region 10, and we are now buying additional pieces of equipment to be placed in other regional hospitals. Okay. In fact, we have those pieces of equipment on order, and we are waiting for them to come into Guyana. So that's another level, another tier, where we are taking the services out to the region and being able to perform those tests right in the region. So you don't have to waste time now to take the sample, send it to Georgetown, then be resend it back, right? So the time, the turnaround time for these tests have been shorter. Okay. Then apart from PCR testing, we have now introduced some time ago the antigen testing. So which means within 20 minutes or so, you can get back the results for your antigen tests. And we have literally thousands of these test kits that we have brought into the country. And therefore, at all of our testing sites, we are able to do antigen testing. So in the government system or public health system, we now have antigen testing. We have the point of care PCR using gene expert machines. We have the capacity that we have built at the public health reference lab, where we can do more than 2,000 tests per day if needed. But so far we haven't had that challenge of being able to do a lot of tests. But this is the capacity that we now have. Outside of the public health sector, Eureka Lab has been able to do PCR testing. They have been certified to do so. And they have also been certified to do antigen testing, which is a simpler test. We have also certified almost every private hospital. So Balwant Singh, Woodlands, St. Joseph, Mercy Hospital, Davis Memorial, they've all been certified, Anamaya in Berbice, they've all been certified now to be able to do the antigen testing. And plus there are an additional few facilities that we have, after being satisfied, that we have allowed them now to do PCR antigen testing. That process of assessing and allowing additional sites to be able to do antigen testing is continuing. And if there's any private sector entity that would like to do the antigen testing, what you need to do is to apply to the Ministry of Health, and we would then send a team to do the assessment to see whether or not we should register you as a provider of antigen testing. So in that way, we are increasing the capacity to be able to do testing using this antigen method.
All right.
So that's testing. We have really increased the amount of places that are able to offer the tests.
Of course, with all this being done, the public still needs to do their part, and this is something you've been repeatedly saying to them: wear the mask, practice social distancing, and so on. Could you? I wanted to ask a question aside from this. Today is World Hearing Day, and we've seen a lot of work. Your ministry has been looking at the various divisions and areas in which development is needed. Could we get your take on it?
Well, you know, with World Hearing Day, it's also giving us an opportunity to reflect on persons who have hearing impairment and what we can do to improve the services that we offer to such person. Some people might have congenital defects where they're born with these types of hearing impairments. Others, as they age, can acquire hearing impairments. So there are different ways in which people can damage their hearing, and there are different solutions in which we can help them. The service that has been available in Guyana has been predominantly through the Ministry of Health. And we have, through our rehabilitation department, over the years, been able to provide hearing aids to persons who need them. There was a program that was in place at the ministry where we were partnering with Star Key to be able to give hearing aids almost free of cost. That program was discontinued some time ago. So we would have to restart a program and be able to fund it if we can't get funding with a partner like Star Key, to be able to fund this so that persons who require hearing aid can access one either very cheaply or free of cost. So that is something that over the last couple of months the ministry has also been engaging in looking at different options so that we can restore this service for persons who have hearing impairment. But as we observe this day of hearing loss and hearing impairment that has been set aside by the WHO, we want to reassure those persons that the ministry is working and we continue to work to improve the services that we are offering, and hopefully that the needs of persons with hearing impairment, that we'll be able to take care of those needs.
Minister Anthony, thank you so much for speaking with us today.
Okay, thank you very much.
Yes, sir. Well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.